Noong nalaman nila na may psoriasis ako, sabi nila, galis yan.
Sabi nila baka nanunuraw ako. Kakalaro ko sa labas ng bahay.
Sabi nila baka may nakain lang daw ako na hindi maganda.
Sabi nila, sa hangin daw ito nakukuha. Mawawala rin daw to.
Sabi nila, gamitin mo ito. Magsabon ka nito. Uminom ka nito. Gagaling ka.
Sabi nila, mag-sweater na lang daw ako para walang makakita.
Sabi nila, lumayo ako. Baka nakakahawa yung balat ko.
Sabi nila, hanggang dito na lang kami.
Sabi nila, wala raw akong kasama sa labang ito. Sabi ko, nandyan kayo. Panahon na para maitama lahat ng sabi-sabi mo. Kami naman ang pakinggan niyo.
Alright. Good
Coach
evening. Good evening, Coach Eve.
Good evening, Coach Jom. So, gabing-gabi na, no? Online pa rin tayo. Anyway, kamusta po, Coach Joms?
Ito okay naman. Actually, very curious ako sa topic natin. Ang haba, no? Neurofibromatosis awareness.
Actually, kanina nga habang nagpa-practice tayo, sinasabi ko, paano ba to bibigkasin? Neurofibromatosis. Tapos sabi ni Direk, NF na lang. O NF na lang daw.
Actually, nag-search din ako. Parang NF nga yung parang ano niya, no? Parang shortcut or abbreviation niya.
Yes.
Anyway, to our weekenders, it's Saturday again. Saturday evening. I'm Coach Joms, one of your hosts, and my co-host here. Ito pala.
Ito, andito ako. Si Coach Eve. And take note, Coach Jom, we're almost like patapos na ng May and then half of the year na. Ang bilis, no?
Oo.
Correct. And ang episode din natin ngayon is already 44th episode, di ba? Ang bilis talaga. Ayun. So, welcome po mga kabalat. Hope you're enjoying your Saturday evening together with us, Coach Jom and Coach Eve. And our topic for today is the Neurofibromatosis Awareness Day.
Yeah, and of course, with our theme, that's I know NF and I care. And of course, our official hashtags for tonight, that's WWP Neurofibromatosis, hashtag Neurofibromatosis Awareness. Ayan.
Yes. Okay. Sorry. Okay. Aside from that, we also would like to congratulate si Hannah.
Yes,
Yeah,
syempre.
si Hannah Sarsoso in her journey for Miss Universe Philippines. Ayan.
Ayan. Ayan ang pride ng Psoriasis Philippines from Agusan del Norte, si Hannah.
Oo nga,
Wow.
di ba? Sana
O, di
ganyan
ba?
ako kapayat, Coach Joms. Di ba?
At Coach Eve, di ba,
Oo.
very supportive ang Psoriasis Philippines kasi we're able to watch their live sa mismong SM Mall of Asia Arena.
Sayang
Ayan,
nga
so,
sayang wala ako nun eh.
ito, nandito yung mga awards niya, oh.
Oo,
MUP, go ahead, Coach Eve.
MUPH Top 10 Finalist, Glam Challenge Winner, Face of Social Media, Swimsuit Challenge, Runaway Challenge, Top 5, then si Miss Kingston's International College, Tinggog ng Filipina, tama ba? Tinggog ng Filipina, Mindanao, and Miss
Yes.
Aqua Angels. So, di ba, ang dami niyang
Hakot Awards.
Hakot Awards for a first time. Tama, di ba? First time siya to join this major beauty pageant. And congratulations
I
again,
believe
Hannah.
so.
Your PsorPhil family is very proud
We're
of you.
very, very proud of you.
Yan.
And of course, ayan, si Miss Hannah. So, Jenna Marie Zarzozo. Again, congratulations. Ayan, nakakatawa, no? Grabe. I hope makita natin very soon si Hannah, syempre. Tuloy-tuloy pa rin advocacy. Yung Miss Universe is just part of it, pero yung advocacy niya tuloy-tuloy pa rin para sa Psoriasis Philippines, para sa ating
That's
mga
correct.
Yes. And speaking of advocacy, Coach Eve, alam mo ba na we are still lobbying for the National Psoriasis Care Act, both in Congress at saka sa Senate. So, we'll just continue to support, of course, by following the hashtags for updates and to create noise about our bill. Ayan.
Tama yan. Ayan po yung mga hashtags as you can see on our screen. So,
Andyan po.
Psoriasis Bill na, Freedom from Psoriasis, Freedom from 2 million Filipinos, and Freedom for 2M. So, tulad po ngayon, sa mga nanonood sa atin, Coach Joms, so wag nyo rin po kalimutan, use our hashtag, yung ating hashtag for tonight. Yan, pinakita ulit direct sa screen. So, WWP Neurofibromatosis, Neurofibromatosis Awareness. So, yun po. So,
Yun.
shout out po sa lahat ng mga nanonood. Magandang gabi
Shout
po sa inyo.
And shout out din sa lahat ng sumuporta, di ba? Thank you so much. And of course, for supporting WWP. And also, don't forget, again, to post your comments, click like and share our episode tonight, and include our official hashtags is WWP Neurofibromatosis or Neurofibromatosis Awareness.
May
Ayan,
tanong ako sa'yo, Coach Joms. Familiar ka ba sa neurofibromatosis?
To be honest with you, totally clueless ako. Pero syempre, coming from the root word neuro, so I think it has something to do with the brain. So probably trauma sa ulo. I don't know. I would like to learn more about it. And siguro mamaya no sa Q&A natin sa doctor natin mamaya, one of our special guests, mas malalaman natin at makikilala lalo itong kondisyon na to.
And we also have a patient with us who will also be joining us our show for tonight, diba? So we have one doctor and one patient, yun. So siguro wag na natin patagalin pa, no? Kasi for sure, maraming mga ka-viewers natin, ka-weekenders, ang curious din, ano ba talaga yung neurofibromatosis? So medyo mahirap siyang tawag i-pronounce. So medyo mahaba siya. So sabi nga kanina, there's parang abbreviation na NF. So, would you like to do the honor of presenting our guest for tonight, Coach Joms?
Yes, Coach Eve, let me do the honor. So,
yes,
our special guest, ayan, right now, she's an adult and pediatric dermatologist, a fellow of PDS, ayan, a certified wound specialist, physician by the American Board of Wound Management. She's also the head of Pediatric Dermatology Unit and Photodermatology Unit of the Southern Philippines Medical Center. She's an academic chair, section of Dermatology, Brokenshire College of Medicine Research Committee Philippine Dermatologic Society. Pasensya na kung may namali ako pronounce. Anyway, private practice consultant, a Southeast Dermatology with 3 branches. So, dalawa ito sa Davao and isa sa Lanang Premier Hospital and the compound. And the other one is in Iloilo, Festive Walk, Mandurriao, Iloilo. So, let's all welcome in our virtual stage. We have our guest, none other than Dr. Jennifer Ang-Tangtatco.
Okay.
Good evening, everyone, and thank you for that kind introduction. Good evening, Joms. Good evening, Eve.
Good evening po,
evening,
Dr.
Doktora.
Jennifer. So, I'll do naman the introduction for our other guests. Okay, our next guest is a PAPO board member and neurofibromatosis patient leader. Please
Wow.
welcome everyone, Miss Ara Lenorio.
Our fellow advocate then. Hi, Miss Era.
Hi, Miss Ara.
Good evening.
Good evening, everyone. Good evening, Doc, Jen, and
Hello. Good
Coach
evening.
Jom and Coach Eve. Good evening.
Good evening po, Miss Ara, and
evening.
good evening again, Dr. Jen.
So, Doktora and Miss Era, welcome to WWP. So, wag po kayong ganong kakabahan. Let's just enjoy this night. We'll just have very few questions. So, we would like to, to learn and know more about this kind of condition po, no? So, I'm just curious po, Doktora. No? I'll just throw this question to Doktora. Ano nga ba? What is neurofibromatosis po ba?
Okay, so when I was asked and I was invited to do this talk with you, the NF Awareness Day, I spoke to them and I said I wanted to be more visual because I think mas maiintindihan ng lahat ang condition when you're able to
Agree,
see.
Doktora.
So I think can you show the slide for me, please?
Ayun.
So we're talking about neurofibromatosis. So ano nga ba to? So it's a genetic disorder of the nervous system. So it causes tumor to form. We know that there are nerves in the body. So at any time, anywhere, tumors can form. And there are actually 3 NF. So there's 1, 2, and 3. But what I want to highlight is more of the NF1. Kasi we know, Ara, this is the more common NF that we see.
Okay.
Right?
Yes, Doc.
So, depende lang on what gene is affected or gene is mutated. You have NF1, 2, or 3. Okay? So, on the next few slides, I'll explain who gets MF. So, NF can affect anybody, both male and female sex, all ethnicities. But what happens is that it is an inherited condition. Ibig sabihin, minamana po ito. So, if you have a parent with NF, you have the higher chance to get NF. So there's 50%, it can be just spontaneous mutation or minana mo siya sa mommy or sa parents, kumbaga, okay? And this is highly variable. Ibig sabihin, there's no 2 case na pareho. Iba-iba ang manifestation in terms of severity and kinds of their clinical characteristics. So we have NF1, yun yung sinabi ko, very common, which I'm gonna go through more briefly in the next few slides.
Okay, Doc.
So this is 1 in 3,000. NF2 is 1 in 25,000. It's much rarer. And lalo na the third one, which is actually even rarer than your NF1 and 2. Okay? So what I wanted to highlight in this talk is the clinical manifestations. Kasi ito yung important na maintindihan ng viewers or those patients who are actually listening. What are the things that we have to watch out for? Okay. Can you show me the next one, please? So this is cafe au lait macule. So that's the reason why particularly a dermatologist is speaking in front of you right now, because this is the first things that you notice. You have lesions, brown patches, usually first year after birth. And when you count, pag marami, ibig sabihin the presence of 6, it's a highly suggestive of your NF. Okay? That's the reason why dermatologists ang nagsasalita ngayon. Even if, like Joms earlier mentioned, it's neuro, maybe it's more of the brain, but the manifestations come in first would be skin.
The derma.
Yes.
Oh.
So the next one would be freckling. Usually this one nakikita sa mga singit. So it's in the folds. It's axillary and inguinal sa kilikili and sa singit. Okay? Next manifestation would be your leash nodules. This is more a technical term, but this it's important that we seek a consult with an ophthalmologist kasi they have to do an examination for this. Ibig sabihin, at birth, when we see the marks, the brown patches, and the freckling, we have to see an ophthalmologist later on to check for these eye lesions. Okay? The next one would be neurofibromas. Ito yung pinaka-common. I think Aaron would agree with this statement that this is the most common neurofibroma in NF. But this appears during later, okay? More during the adolescent period. So these two photos I wanted to show is that pareha silang neurofibroma. But take note, in a younger child, it looks very subtle. Hindi siya masyadong halata as compared to your adult NF, which is very pedunculated, actually malaki, and it's mas marami. Okay? But of course, this is neurofibroma. So these are the common ones. Again, freckling, cafe au lait, neurofibroma, and the eye lesions, which yung dermatologic manifestations would appear very early. Okay, so alam na natin ano ba ang kailangan bantayan ng parents ng may MF. If you have NF, so there's high likelihood. So ano ang mga less common features? The child can have developmental difficulties, difficulty reading, gross motor, and even social skills. And it's important that we do early intervention. Kasi when you notice these children to have difficulties in reading or even making friends, it's important that they are seen by our friends from developmental pediatricians. Yun yung importante dito. That's why we're discussing what are the other features of your MF. Next is your plexiform neurofibroma. It looks scary, it grows big, but do understand that rare naman silang nagiging cancer. But you have to, watch out for these lesions as well. Okay? Another is a glioma. Ano ibig sabihin? It's an optic nerve glioma. So optic nerve, it connects, yes. So the nerve connects the back of the eyeball to the brain. Okay? Kaya NF can also cause the optic nerve glioma. So this is very important that these patients see not only a dermatologist, but also an ophthalmologist or even a neurologist later on if deemed important. Okay? Next, other features, these patients can have high blood pressure. Ibig sabihin, at an early young age, when they are diagnosed, BP should be monitored already. Hindi ibig sabihin when adults lang ang nag-check ng blood pressure. Next one would be the bowing of the bones and the scoliosis. So it's important that we check these things. Kailangan din silang ma-refer sa orthopedic surgeons. Why? Because bones can be affected early on in their lives. Scoliosis or curving of the spine can be seen in these patients. And sino ba may higher risk? Those children that did not reach the adult height yet. So, ibig sabihin, the earlier the intervention, it would be much better. Okay? And of course, not that common, but these patients have higher risk for soft tissue tumor and brain tumor. So, anong kailangan bantayan? Problems in vision, pain, or sometimes headache pag meron. Okay? So, those are the things that we have to watch out for in your NF1. Moving on to the next, we have growth. Okay? So, paminsan, they can be excessively tall or heavy, but others naman have short stature. So, it's important that growth should be monitored as well. So, these are just, but I think the main thing now is how do you actually diagnose? Okay? So, these are just a checklist. So, lahat yan na-discuss ko kanina. One or two of the following will give us an idea. So this may be NF, okay? And we're talking about neurofibromatosis 1. It's just that I wanted to show you the photos para hindi natin makalimutan. It's more for us to understand what are the things that we have to watch out for. Just quickly, kasi nga we're talking about NF, there's NF2, but this is not that common. Manifestations not so much on the skin, but usually for these patients, more on the balance and the hearing, okay? So, ito yung not so much in terms of skin manifestations, but brain, hearing, visual, spinal tumors. Not so much for the skin for NF2, but this is not that common. The last one would be your schwannomatosis, which is also NF, but much more rare than your NF1 and NF2. This time naman, unlike your skin manifestations for your NF1, these would manifest more on central nervous system. So mostly brain, hearing, and so on. So ito ata yung sinabi ni Joms kanina, more neuro. Okay? But do understand the more common NF is actually manifesting with skin. Okay? And then, so ito yon, like what I've mentioned earlier. And of course, I want you to remember that living with NF is not easy. So these individuals, based on studies, they have lower quality of life. This is correlated by pain, anxiety, and depression. Sometimes the physical appearance is affected in terms of the quality of life in these patients. And of course, I want you to remember it's important to do a multidisciplinary approach. Kaya I've mentioned, I wanted to show the slides just so you understand if you see this symptomatology or signs, it's important for you to refer, okay, for later management and prevention of the complications. So I think that's it for NNF. I think this will make it easier for you to understand.
Yeah.
Actually, yun nga po eh.
Verbal, wala. Hindi yung ata. Yeah, it's difficult. It's more visual than verbal.
Okay, may tanong lang ako, Doktora. When you mentioned kanina yung sa baby na parang patches, hindi ba siya yung parang balat? Ganun ba po siya? Or parang meron siyang lump or something?
So, the first one that I've mentioned is the cafe au lait macule. So, balat macules are actually flat. So, it's just like a mark present at birth or few years after. Kaya paminsan they say, oh, it's just a birthmark. But remember the magic number I've mentioned? If it's 6, so it's a suggestive for NF. So when I did my training in Canada, yun yung parati naming hinahanap. Do you have 5 or 6? When it's 5, it's not the criteria for NF. So it's a different condition. But remember the magic number. For the parents naman, baka you're gonna panic pag may makitang balat, NF. No, it's not. So remember, if it's 6, then it could be NF, and it's important that you see, of course, dermatologist for that. Kasi sila naman yung makaka-assess ng mabuti.
Okay. Kasi iba sabi, ang dami mong balat, parang natutuwa pag without knowing na baka it's really more of the NF na. So, dapat as early as...
Manifestation na pala.
Oo, as early as now, parang pag nakita mo ang dami mo ng balat sa katawan, lalo na for sa mga bata, pinapacheck na siya agad ng parents sa derma.
Yes. And actually, doktora, no, napansin ko lang, ang dami palang manifestation or unlike sa psoriasis kami po, 'di ba? Minsan usually nabanggit nyo po kasi kanina sa singit, kilikili. Sa atin ang start is sa ulo, 'di ba? Tama
Usually
ba, Coach?
sa ulo, sa scalp.
Sa ulo, sa scalps down to our ears. Kayo po, I mean, alam ko pong marami kayong patients. How do you differentiate those kind of ano po ba?
So actually, the freckling, so the term freckling that they say in NF, it's a specific finding for NF. So kunwari, may pumuntang pasyente, may balat, multiple marks on the body. So what do we have to check next? Is there freckling? So freckling would be seen sa mga singit. So if there are freckling sa kilikili, sa singit, you already have 2 criteria. Ibig sabihin, this is highly suggestive or your patient has really MF. Kasi baka other clinicians would say, hindi yan NF. Alam ko yung NF, yung maraming bilog-bilog sa katawan. Remember, I showed the photo earlier that only during adolescent period, you'll see those lesions. Timeline is very important kasi sometimes you will be diagnosed later in life when you have that. But to understand the balat alone and the freckling is an early manifestation of NF already. And you can be diagnosed with NF kahit yun lang, kahit wala yung bilog-bilog.
Kasi pag malaki na
yan.
ata yung adolescents na yung may mga lumps po.
Tanong ko naman po si Ms. Ara. So, kanina sinabi ni Doc yung kung kailan siya nadadiagnose po. Kayo ma'am, kailan po kayo na-diagnose with neurofibromatosis?
Ayan, magandang gabi po ulit sa lahat. Actually, na-diagnose ako at the age of 16. Yung mga sinabi ni Doktora kanina, it manifested on me. Yung may balat, yung may leash nodules, ganyan. Yung may mga frecklings, ganyan. So, at first, syempre, nung bata, dahil that time wala pang Google, hindi pa namin alam kung paano yung ano lang, searching, di ba? Nung bata ako, marami na akong balat. Marami na akong birthmark. So, akala namin, balat lang. And since bata ka, katuwaan, and I am the youngest in the family, binagbibilangan. So, sabi pa namin, oh, you have 69 balat. So, akala namin, ano lang, parang, sabi namin, parang ano lang, parang nagkakatuwaan pa. But when I was 16, katulad ng sinabi ng doktora kanina, no, I lost weight. So, sobrang payat ako. Tapos, my eldest brother noticed na parang kung merong, what do you call this, bukol na dito, lumalabas na yung litid ko dito sa leeg. So, sabi, let's have a check-up, ganyan. And yung leash nodules ko, at the age of 15, meron na dito sa left eye ko. So, akala din namin una, yung galing naman, ang cute naman, may balat ka sa mata. Sabi pa namin gano'n, ano. But eventually, nung sinabi sa amin ng doctor na, your daughter has neurofibromatosis. So sabi namin, ano yun, Dok? Sabi namin, may nakain ba ako? Just like, okay, may nakain ba ako?
Yes.
Wala naman pa ako nahawakan na may mga ganyang bukol or something, sabi ko pang gano'n, ano? Nung pinapaliwanag ko sa amin, it can be genetically inherited. So, when we researched on our family, we found out that sa mother's side ko, meron pala siyang auntie who has multiple leash nodules and cafe au lait. So, parang sabi namin, ito na. But when we were asking, Dok, anong best medication? And then we were told that wala pa pong gamot sa NF, sa neurofibromatosis, sabi gano'n. So, at first, sabi ko, ano to? Sabi ko, how will I live my life? Siyempre, at the age of 16, you're full of dreams, meron ka maraming gustong gawin, pero parang ikakat kasi sinabihan kami ng doctor na pag umidad po yung anak nyo, matatabunan ng bukol yung buong mukha niya at buong katawan niya. So parang, another thing na sinabi sa akin niya, parang kang binuhusan ng mainit at malamig na tubig na pinaghalo, hindi mo na alam kung ano yung mararamdaman mo. Yung mga ganong eksena during the time that I was diagnosed.
Actually, Doc Jed and Doc Miss Ara, usually ganyan din before, yun sa mga first SOR patients na na-diagnose, nung parang hindi pa talaga sila aware sa sakit, lagi sasabihin sa'yo, ay, wala pong gamot dyan, lifetime na yan. So, usually mga bata that time, parang, ay, paano na po ako? Ano na yung mangyayari sa akin? So, nawawalan na sila ng self-confidence, diba? Parang, pag sabi mo na takpan na ng buong mundo, parang totally, wala na. Parang nawalan na sila ng pag-asa na gagaling pa sila. At least for now, sa mga ngayong panahon ngayon, we are now more equipped, more knowledgeable dun sa mga ganyang sakit. So, mas naalam na natin how to treat and ano na talaga yung mga nagiging symptoms po. Tapos, may tanong ako, Doktora, for Miss Ara to. Sabi niya po kasi kanina, genetic siya, diba? So, sa kanya po parang nag-skip ng generation?
Yes. I'm sorry, Coach Eva. Sa akin kasi, parang ang nangyari is, nung sa generation ng aunt ng mother ko meron, pero sa generation niya wala. Tapos sa generation namin meron. Among the family, ako lang yung meron. And among the generation, kami na sa amin na nasa side ng mga cousins ko, ako lang ang meron. So sabi ko nga, when they said that it genetically can be passed on, sabi ko, pwedeng yung mga anak ng kapatid ko magkaroon or pwedeng mga magiging anak ko. Sabi ko, parang, wag naman. Siguro parang sabi ko, this will be fine kung ako yung meron, pero wag na yung mga anak ng kapatid ko or wag na yung magiging anak ko. Kasi, to give you a short story din, yung mga pamangkin ko, lahat ng pamangkin ko, kung saan ako may spot ng balat, may tagi-isa silang spot ng balat. So sabi ko, Lord, wag naman. Sabi ko gano'n. So parang, ayokong maranasan nila yung naranasan ko. Especially now, we all know that the bullying, the discrimination in social media. And mahirap minsan when it comes to yung sinasabi din doktora on the mental health of a patient who has NF, especially pagka physical appearance yung affected, it was really, really hard. Napakahirap po na apektado ang physical appearance ng isang pasyente na may NF.
Ayun. Nabanggit niyo po, no, Miss Ara, it's really affecting your quality of life. I just want to ask, this is really out of the context, no? Are you also part of the PWD po? Kasi grabe yung
Yes, right now, before medyo hirap kaming makakuha, but because of the Rare Disease Act na ipinas, that NF is already part of a person with the PWD. So,
Opo.
yes, we are.
Okay. How for doktora po, like for example kay Miss Ari, pinagdadaanan niya, ano po ba yung mabibigay niyong tips on how they could properly manage or treat this? I mean, apart from, of course, pagpunta po, pag-consult sa mga doctors, ano po ba yung, like for example, tulad po niya, nabanggit niya na yung pamangkin niya, may mga balat na, I mean, what are the things or tips or anything na dapat tignan agad or gagawin po agad?
With any genetic disorder, because we're dealing of, remember, NF is a genetic disorder, ibig sabihin minamana siya. You mentioned skip years a while ago. Since it's an autosomal dominant condition, meaning hindi lahat ng anak magkakaroon. 50% of the chance they may not have NF, 50% may have NF. So, I think with any genetic disorder, kahit NF or any form, it's important to have like genetic counseling. You have to understand the condition. You have to understand how many percent of my offsprings or ilang percent sa aking mga anak will have the possibility of having the said condition. Because it's important that we do family planning. I had a patient earlier, which I did rounds, same baby, not NF, but a genetic condition. First baby ng parent. So I had to tell them, it's important that you understand the condition, know the complications, know the possible sequelae of this condition, and understand kung ilang percent ba sa mga anak mo ang magkakaroon. And then moving forward, if you have children, you know already what to watch out for. And alam mo na it's important to seek consultation early on than later. Because sometimes just a simple balat is a sign of NF. A simple problems in terms of school, math, English, reading, social skills. Minsan kasi others would say, okay lang yan, balat, matagal lang talaga nagsalita, matagal lang talaga. So it's important that you understand. I think that's the bottom line of any condition naman. And in any genetic disorder, you have to understand ilang percent ang magkakaroon sa mga anak ko at sa mga pamangkin ko. And at least with that, you understand that once your child has a single sign, then you seek consultation right away. Kasi of course, we know that the earlier you seek help, the earlier or the more chances that you prevent the complications.
So, dapat po pala hindi mo ipagbabawalang bahala kapag may napansin ka ng kakaiba dun sa skin ng anak mo, lalo na kung madami talaga yung sinatawag nating mga balat.
Like Ara mentioned earlier, she has 69, sumobra na siya sa magic number natin. So, yeah.
Kasi ibang parents kasi parang natutuwa pa, daming balat ng anak ko, something. Diba? May tanong din po ako for Doc Jen. Di ba po may mga different types siya? Yung po bang type 1, pwede siyang mag-evolve to type 2 or dun sa isang
No. Type 1, 2, and the other one are 3 different types because they have a specific gene mutation. So when you have the certain mutation, you get the 1. If you have the mutation for 2, then you get the other one. So hindi pwedeng nagpo-progress si NF1 to schwannomatosis or the one will progress to the other. So it's a specific gene mutation for a specific condition.
Okay. Thank you po. At least malinaw yun kasi baka mamaya yung ibang meron matakot lalo sila na ay baka
mag ano,
With
'di ba, mag-iba,
NF2.
mag-evolve to 2 to 3, ayan. Ma'am, tanong ko na rin po, how do you manage, Miss Ara, your condition po, yung neurofibromatosis?
Ako siguro one thing I've learned with this condition, ano, sabi nga ni Doc kanina, no, neurofibromatosis is hard to spell, hard to pronounce, pero the hardest part is to live with it. But siguro ako one thing is I took it as a challenge for myself na nung sinabihan ako na parang buong katawan mo at mukha niyo po tutubuan ng bukol. So sabi ko parang sige, sabi ko would believe it or not, I had parang sabi ko nga one-on-one talk with God. Sabi ko, Lord, I will accept that challenge. Sabi ko ganun, I'll accept this. But ang hihingin ko lang po is kung ano lang yung lalabas sa katawan ko, yun lang. And ako na lang. So with that, luckily, I've been living this condition for 30 years now. And I'm working as a broker liaison officer. And I'm also working in a company owned of my sister. So, malaking bagay kasi yung trabaho ko is also part of you have to deal with people. You have to face people. So, nowadays, nakakatuwa na rin naman na may mga taong very sensitive who will ask you, I hope you won't mind, I hope you won't get offended, may we know what is your condition. So, pag pinaliwanag mo sa kanila, malalaman nila, may ganyan pala silang sakit. Minsan nga sasabihin, kapatid ba kayo ni psoriasis or kapatid ba kayo ng monkeypox or kapatid ba kayo ng scoliosis? So parang kinoconnect nila yung condition, parang ang tawag na is kapatid. So parang with this, parang sabi ko nga, I won't take it parang as a disease but a condition that I know that somehow ang magiging manifestation din sa ibang tao na despite of my condition, sabi ko, I might be different, but I can always make a difference, di ba?
Wow, that's good. Speaking of that difference po, no, same with other conditions kasi, di ba, may mga myths or misconceptions yan eh. Could you share with us, or probably Doktora or Miss Ara, may mga, may mga misconceptions po ba about this condition?
I think before Ara would mention a few, what I want to highlight with the misconception is that this condition is not contagious. I think it's very important to understand because NF would have many skin manifestations. Pwedeng kukonte, few bumps on the body, but what Ara mentioned, it can be all over the body. So people should understand that even if you see these patients beside you at church, in the public transportation, do understand that they are not contagious. So I think yun yung very important for this NF Awareness Day.
Yes. Yeah, actually, totoo yung sinabi ni Doktora because somehow, hindi mo may iwasan na pagka nasa public transportation ka, titignan ka ng mga tao, minsan iiwasan ka, and it happens most of the time, especially sa mga kasama ko sa support group na may mga NF doon. So, minsan yung mga ganong bagay, a simple act of gesture sa mga kasakay, smile, or yung just give them a simple smile, malaking bagay na rin sa aming mga patient. And minsan nga, yung stigma, gusto rin naming mawala na, baka nakakahawa, kaya ayaw dumikit. But we are not contagious, sabi nga ni Doktora.
Actually nga po, hindi ko lang matandaan, no? Pero before kasi, parang may napanood akong movie or something na meron ata isang condition na ganyan, isang yung character na ang ginagawa sa kanya, binabato siya kasi parang nakakahawa daw, but ang dami daw niyang mga bukol sa mukha. So, hindi ko alam that time na yun pala yung tawag sa kanya. So, hindi ko lang matandaan kung anong movie siya, but yun yung naging parang naging treatment sa kanya na talagang sabi nakakahawa ka, lumayo ka dito. So binabato sila ng tao because I think it's also good thing na right now meron tayo talagang mga awareness, yung neurofibromatosis awareness para at least everyone will not think that this is contagious, na this is something that a rare condition na nangyayari sa mga tao, sa mga katulad natin na hindi natin alam, bigla pa lang sa family may genetics pala. So it's a good thing talaga that this awareness is something that we really have to at least celebrate for every 17th of the month, right, Chom?
And I just like to ask din po kay doktora kasi ang daming mga doktor andyan yung dermatologist, andyan yung neuro, andyan yung opta. I mean, ano po ba yung usual na gamot nila? Like for us, we're using topicals, we're using orals and biologics. Those are the types of mga medications na ginagamit namin. Sa ano po ba? Sa NF po ba, ano po ba yung unang ina-address? Is it the skin? Is it the neuro? Or is it sa mata? Or depende po sa manifestation?
So actually to date, no, there is no known treatment for your NF. It's more supportive treatment or supportive care as complications arise. So ibig sabihin, the earlier you get it in the stage, the better you manage the condition. Kaya when you see this lesions early on at birth, you want to refer them right away. Do I refer them to an ophthalmologist para makita agad if there are lesion nodules? Work with the pediatrician para makita in terms of height, blood pressure control, is it okay? And we also work with neurologists if my manifestations. So it's not more on the treatment per se, but preventing the complications as they come.
All right. Doctora, just a follow-up question. This is coming from, of course, the founder of Psoriasis Philippines. Are there other serious conditions that patients with NF must watch out for? May mga comorbidities po ba?
So
yung
talking
NF po?
talking about comorbidities, we'll start with that. I mentioned earlier, hypertension is one. Kaya children with MF should have BP monitoring. Hindi ibig sabihin adult lang ang nagmo-monitor ng blood pressure. Second, in terms of serious condition, we talked about tumors earlier. Sinabi natin they have slightly higher risk for tumors, both benign and malignant. So ibig sabihin, the tumors that they have can progress to malignant transformation. So ano ba ang kailangan bantayan? If it's constantly painful, lumalaki, there's different texture, then there's a possibility of a malignant transformation of the tumor. Sometimes naman for neuro, like what you mentioned, Joms, earlier, is manifestations could be dizziness or headache or ganon. So these are the things that you have to watch out for kasi these are signs that there's a possibility of these benign tumors to progress to malignancy. So these are the things that you have to watch out for.
Thank you po, Doktora. Doctor,
sorry, ikaw na, Coach Jones.
And I just want to ask kasi nabanggit ni Doktora na yung NF1, though siya yung very common, pero this kind of condition kasi is a rare type of condition. Dito po ba sa Philippines, ano po bang prevalence or number of patients po ba natin currently? If you have any record po, Doktora, sorry.
I'm not quite sure in terms of how prevalent, but I think in terms of how often do you see, it's actually 1 in around 3,000 as compared to 1 in 25,000 for your NF2. But I think the support group, Ara, do you have a number in terms of Philippines? Ilan ang nagkakaroon ng NF? But in terms of worldwide, it's 1 in 3,000. I think Ara can give you a better number for this.
Yeah, thank you, Doc. Actually, sa page namin, no, the Neurofibromatosis Friends Philippines, it's a mix of of NF patient there. We have NF1 and NF2 patients. So most likely, we have already 400 to 500 members. So marami na rin talaga siya. Actually, marami talaga siya. And if you will think of it, parang at least 2 million people is affected of NF, both NF1 and NF2. Worldwide. Marami na rin. So we have, may mga support group din from other countries, like in the US, like in Australia, in New Zealand. So marami na rin people living with NF who sometimes is very very vocal na rin, and talagang nakikita na rin kung on how they also spread awareness about NF, and also how they become an inspiration for other patient and other people, maybe with NF or non-NF patients. So, yun yung malaking bagay din na naitutulong ng support group.
So, oo nga po, nakisasabi niyo po may support group. Sabi rin ni Doktora, since wala tayong treatment for that, it's really more important na talagang meron support coming from family, friends, and also yung support group ng neurofibromatosis group. Kasi syempre, sino po ba makakaalam or makakatulong sa atin kung hindi rin yung kapwa nating patient?
Patient, yes. Actually, recently, we just have yung parang small get-together of NF for just to celebrate also NF Awareness Month para sa aming mga NF patient dito sa Philippines.
Yan. Ayun, Joms, habang kanina nawawala ka, syempre, pag live may mga technical difficulties yan. Nasabi nga ni Miss Ara na nagkaroon daw sila ng get-together din. Di ba parang tayo lang pag nagkaka-get-together sa PsorPhil? Yun.
Ayun, sorry. Ang hirap pag may mga kiddos sa paligid.
Actually, wag ka mag-alala. Kapag live talaga, may mga technical difficulties yan. Buti nga yung mga dogs ko, tahimik pa ngayon eh.
Oo. Ayun. So, actually, natutuwa lang ako kasi habang pinapakinggan ko si Doktora, it's like you're also talking sa mga doctors din natin. Although, syempre, from PDSC si Doktora, parang may similarity rin, when it comes to quality of life, when it comes to how they handle, yung mga fears nila halos the same, di ba? So, ikaw ba, Coach Eve, same rin ba yung experiences mo?
Yung mga fears?
Oo. Yung acceptance,
Oo naman.
no?
Acceptance. Siguro din before, parang tulad ni Miss Ara, noong panahon na yung bata rin ako na-diagnose, at sinabihan ako, ay, wala na yung pag-asa, walang gamot yan, lifetime na yan. Hello, parang I'm around 16 that time, sasabihin sa'yo, ganun, nasa high school. Parang gusto ko sabihin sa doktor, bakit? Ganun. Ang dami ko talagang pinuntahan din, doc, mga iba't ibang derma just to say na ganun nga. Tapos yung nga sabi, parang wala pa daw treatment. So parang ikaw na bata ka that time, para mawawalan ka ng pag-asa, di ba? Ayun. So ganun din naramdaman ko before. And I think sabi ko nga kanina, support group will be very good for us na meron talagang mga ganong condition kasi doon mo makikilala din yung mga kasama mo sa kabalat mo or something, katulad kay Miss Ara, yung mga ka-NF niya, di ba? Ayun. Naku, malapit na tayo maubusan ng oras, Joms. Hindi ko, ang bilis ng oras natin, di ba?
Oo nga.
Pag maganda talaga ang topic hindi mo namamalayan na umaabot na pala tayo ng almost 1 hour. Yun.
Yeah.
Meron ka ba bang tatanong kay Doktora or any more message that you want to share, Miss Ara and Doktora, to our audience?
Ara, do you wanna go first? Or,
Yes, or any promotion or anything
Yes.
na gusto nyo, like for example, name ng group nyo po or future event or anything po.
Ayan, siguro po for those who are pwede yung mga patient na still parang takot pa na lumabas because of NF. We have our support group po, the Neurofibromatosis Friends Philippines. You can check it on FB, on Facebook. So ayan po, nakikita natin. And just a message of more of encouragement for my co-patient like who have NF. We are not alone. Huwag po kayong matakot. Hindi po tayo nag-iisa. And huwag niyo pong isipin na our condition will always put us down. No, because we can also make a difference. Anything that we wanted to do, kaya po nating gawin. And anything that we dream, kaya nating maabot. Basta po maniniwala tayo sa ating mga sarili at alam po natin sa puso natin na itong condition natin, mas tayo ang nakakaalam po kesa sa mga taong nais tayong pababain. Pero ang pinaka-importante po is ang NF po at tayong mga NF, sama-sama po tayo at hindi po tayo nag-iisa. Salamat!
Thank you po.
Thank you, Ara. So again, remember May is a Neurofibromatosis Awareness Day worldwide. may this lecture or talk be or raise awareness to the viewers and even to other physicians the different manifestations of your NF. May this be a learning ground for everybody that although skin manifestations is very obvious in your NF, there are so many things that we need to watch out for in terms of course, sa mga other physicians dealing with NF, and of course, for those patients or other who sees these patients, tandaan po natin that they are not contagious and they actually need our help in order for them to live a better quality of life. So, if you find the features early on, babies, maraming balat, the magic number is 6, it's good to seek consultation, seek help. We have different board-certified dermatologists of the Philippine Dermatological Society. You can go through their the page, and then you can see different doctors available in your area. And I hope that this is a great venue for you to understand the disease condition. And for that, thank you again for inviting me tonight.
Of course,
Wow, thank you so
Doctora.
much. Coach Eve, may napansin lang ako, nang clinose up sila kanina, may mga kamukha silang artista, si si Miss Ara, hawig niya si Yula Valdez, tapos si Doktor, hawig niya si Agot Isidro. I don't know if it's just me, napansin mo
Naku,
rin ba?
na showbiz talaga tayo, kapatid,
Hindi totoo, 'di ba? Pero ayun,
Oo.
Doktora, sige Coach Eve, go ahead,
Oh,
sorry.
Doktora, so we also want to ask you, saan po kayo nagki-clinic para we can share with our audience kasi baka mamaya meron pala silang
Opo.
kakilala or meron na sila palang kamag-anak na meron palang signs ng neurofibromatosis pero nahihiya lang pang magpa-consult or hindi pa sila fully aware.
Or
So, okay,
social media accounts na open po.
Yes
I
po.
actually do private clinic. We have 3 clinics, 2 in Davao and 1 in Iloilo. So for Davao, we have Southeast Dermatology. This is in Matina. The other one is in Lanang. And of course, we just recently opened another one in Visayas. It's in Iloilo. And of course, aside
Wow.
from the private practice, I'm also part of Southern Philippines Medical Center. I head the pediatric dermatology unit for SPMC, so I do government practice as well.
Yan. Ayan, so, so taga Davao si Doktora. So, yung mga taga Davao dito, yung mga Davaoenos. So, and taga Iloilo pala, no, Coach Shom. So, pwede niyong
Yes.
puntahan si Doktora. So, yung clinic niya, na-flash natin sa screen a while ago. But, if hindi niyo siya na-capture, ayan, ipa-flash siya ulit ni Direk. Yan. So, tandaan lang po
Ayan.
ninyo yung mga clinic ni Doktora. Yan. Usually po talaga, ang specialty ni Doktora is really more of the pediatric. Tama ba? Mali-mali ata ang
No,
pronunciation natin.
I actually do adult and pediatric there. But of
Yes.
course, if you're out of Davao, not from Iloilo, there's always Philippine Dermatological Society. There's a lot of us all over the Philippines, so you can check those out too.
Yan. So,
Thank you.
ayan.
Alright.
Thank you din po. Thank you
Thank
again,
you.
Dr. Jen and Dr. Ara, Ma'am Ara
Miss
for
Ara.
gracing gracing our show tonight. So kahit weekend po, you are here joining us for this Neurofibromatosis Awareness Day.
Yes,
Ayan.
thank you so much, for your precious time, and hopefully, Doktora, no, hindi lang ito yung first time, and hopefully in the future, kung free po kayo for the next
Yes.
topic po. Ayan.
Of course, sige lang. Just give us a call. Just give me a call or just text me.
Thank you din po. Yes po. And again, good night and welcome. Ano bang welcome? Ba't ba ako nagwe-welcome? Good night and then po. And enjoy your weekend, the rest of your weekend, Doktora and Miss Ara.
Have a
Thank you,
good
Coach
night,
Jo.
everyone. Thank
Good
you.
Night po.
Yes.
Weekend.
And also to our weekenders.
Coach Yom, ako na. Ako sabi ko nga, diba, pag may live talaga, maraming mga technical difficulties. So,
again, thank you for our weekenders for joining us tonight and our guests. And then I hope we can see you again in the future for our future episodes. Okay, so see you again next week for another exciting episode for Wellness Weekends Philippines. Tandaan po natin, this is every Saturday at 8 p.m. So please tune to our channel. So kung yung mga hindi nakakapanood ng live right now, we also, this is available through our YouTube channel. Yan, so Weekend Wellness Philippines. You can also check our Facebook page para sa ating mga updates and also our YouTube channel, which is PsorPhil channel. So, mamaya lang siguro naka-upload na yung ating episode doon. So, you can also watch that. And of course, sorry, nabubulol ako kasi nawawala si Coach Joms. Okay, so, of course, we want to hear from you. We can provide your feedback so we can keep improving our contents. You can fill out this quick survey. Yan. So, makikita nyo po sa screen. Let us know your thoughts and then your answer will be anonymous. So, www.bit.ly/wwp feedback form. And of course, we would like to thank our sponsor, Novartis Philippines. Yan. So, Novartis Philippines, thank you for being our number one supporter for our Wellness Weekend Philippines. Ayan. So, ano pa po ba? Ano pa ba masasabi ko? Sabi kasi ni Coach Joms nawala na talaga siyang tunay. Ang hirap po talaga kapag live, no? Ang daming technical difficulties na nangyayari. But again, thank you so much, Dr. Jennifer and Miss Ara, for gracing our show tonight. At hopefully, hindi po kayo magsasawang to join us for our other episodes in the future. O, Coach Jom, ikaw na. Uy, nakamute ka, brother.
Again, thank you so much, Doctora and Miss Ara, for being our guest, and hopefully in the future po, no? And see you again next week. Wellness Weekends Philippines, your official channel for your weekly guide on health and wellness. So may I invite, of course, our broadcast team to join us.
Yan. So, si Sir Joseph, si Coach Tom, si Direk, and I think si Miss Milo nandito din. Yan. So, magandang gabi ulit po mga kabalat, and thank you for joining us for this 1-hour episode of our micro.
See you next week.
Thank you. See you next week. Happy weekend, guys.
Thank you, Doctora. Thank you, Ara.
Thank you, Doctora. Thank you, Miss Ara.